One of the things we're very interested in is understanding how the therapies that we give our childhood cancer patients are impacting them long after their therapy. So what kinds of late effects they're experiencing. And obviously one of the most devastating late effects can be a second cancer after they've already been cured of a first cancer. We know the rates and risk factors for second cancers for children who were treated in the 1970s and 1980s, but what we wanted to understand was whether those have changed as we've kind of altered the therapies that we've been giving kids over time. We use data from the Childhood Cancer Survivor Study, which is a large cohort of 5-year childhood cancer survivors treated between 1970 and 1999 at one of 31 centers, and they had typical childhood malignancies. We looked at data from all of the childhood survivors who've submitted baseline questionnaires and then follow-up questionnaires, and they report whether they've had any sort of second cancer or other late effect of their therapy. The CCSS study then follows up on identifying pathology reports from any second cancers. We review those personally and decide if they meet criteria for being considered a second cancer or other type of neoplasm and include them in the study. We then analyzed all of those based on the time the child was diagnosed with their initial cancer, based on their attained age now, based on a number of other clinical factors, and looked at the second cancer rates. So what we saw was that over time we have seen a decrease in second cancer rates. So for overall secondary neoplasms, which include both malignant or sort of typical cancer neoplasms, as well as skin cancers and something that we call meningiomas, we've seen overall for all of those together about a 15% decrease for every 5-year treatment era in second cancer rates, which is really great. We've also identified with the malignancies specifically a 13% decrease for every 5-year treatment era. We also did a further analysis to understand whether those decreases were due to changes that we've made in treatment over time, and we were able to see a treatment effect for the decreases, which is important and kind of exciting to see. I think the take-home message is that we've made progress in terms of reducing the toxicities of some of our therapies and reducing the second cancer risks over time. However, we also know that the survivors remain at increased risk compared to the general population, so there's certainly more work to be done.